So I just finished watching the show Chernobyl and I'm kind of obsessed. And for me, everything sort of comes back to the science. So let's get to it. Of course, in this show, lots of the characters came in contact with harmful doses of radiation. One of the prominent features of acute radiation poisoning is nausea and vomiting. In fact, in the show, this scientist here, who, comment if you know his name by the way, was involved in the Chernobyl disaster, and after being exposed to radiation, had a very iconic scene of him vomiting afterwards, which he's about to do in this photo. Now, the reason why this happens is throughout our GI tract, we have cells called enterochromaffin like cells. These are neurohormonal cells that essentially help regulate our gut function. For reasons that are not entirely clear, exposure of these cells to high amounts of radiation causes them to release a hormone called serotonin. And high amounts of serotonin act on the medullary vomiting center in the brain, leading to nausea and vomiting. This typically occurs at around 1.5 grays or about 150 rads of radiation exposure. Typically, with a higher dose of radiation, you have an earlier onset of symptoms as well as an increased severity. And that's how you get radiation-induced nausea and vomiting.